is my doctor, Dr. Lucero, my good friend, and he's doing the test here.
Hi.
This is some Russian technology machine, and this headphones record a magnetic field which communicates with every cell in my body. I don't really understand it, but it's beyond amazing.
Okay, we're going to start the test. We're going to start the scanning.
It's saved the last one?
Hmm?
Did it save the last one? Does it save the other one?
Yes, I do have it.
Okay.
Yes. Okay, as we can see here, you see the difference between, I'm going to pause this, go back, so we can freeze the image.
Okay.
Okay, we're gonna go method therapy. Okay, as you can see, what is the difference that you notice here?
I don't see any fours.
You don't see any
Or
fours.
fives.
You only see threes.
Threes.
1, 2s, and 3s. Okay, so it means that eventually you are in this particular part of your body. You are healthy right now. You are evolving. Okay, so we are improving.
Okay.
Now this is what we call an MRI take. Okay, this is a virtual model of the skull. Okay, in which we see a model of the brain, the sinus, the mouth, tongue, the spinal cord right here, and the vertebrae. Right? Some muscles from the neck for the lower part. So all these regions right now, which the last time was affected, especially right here in the tonsil area, okay, has improved a lot. Okay, even though you are much better here, like that, I will provide you some method therapy in order to continuing improving, okay, the process of recovery.
I'm never going to lose my health again.
Hope not.
I'm not.
Hope not.
I'm not. I learned a lot these last couple months. You know, I always have to go to the line, Doc. I'm getting too old to push it to the edge anymore. You know, I don't want some big failure thing that is serious to the point that, you know, these certain type of things won't help.
It is recording?
Yeah.
Okay, just for the recording and for the listener. Okay, what this system actually does is that all cells in the body generate certain frequencies, right? And these frequencies are recorded in a database right here in the system.
Okay.
Now, the models that we have here, okay, are compared to the one frequencies that you have currently.
Okay.
So it makes a comparison, and out of that comparison generates a mapping of the section of the body.
Right.
So the details, the figures that are spotting cell formations in the body, like for instance, the yellow hexagon against the triangle, I consider health levels from 1 to 3, which is considered healthy.
Okay.
If when you start appearing inverted triangles, which we did not saw there. So number 4 is considered first stage stress in the cells. 5 and 6 are considered first and advanced stage of disease, of a certain disease in a certain spot in the body. Okay, so what we're doing with the method therapy, we just saw the application of frequencies that will recover the health of cells. How is that? Well, the input of the system into the cell will be a new frequency that will allow the cell to start generating normal frequencies, at the same time recovering from a certain aggression. Okay, So by its own means, the cell will start healing
Mm.
and repair itself. This has nothing to do bad if we can provide them some help with allopathic or homeopathic treatments.
Right.
You know, we can either use one or the other.
Right.
Okay, homeopathic, or herbal, or supplementary, or even allopathic treatments like antibiotics,
Right,
anti-inflammatories, and such thing. Okay, we're gonna start scanning another part of the skull. This is another take that will represent as it is as an MRI take. Now this is a transverse cut in which we can see the eye sockets right here. We can see the nasal part here section, part of the brain, and as we can see, Pat has improved dramatically. Because in the past he shows a lot of 4s, 5s, and 6.
Yep.
Right now it's only pure 3s and 1s. This is another take 2 of the nasal cords right here, the sinuses, which look pretty good.
Yep.
Okay.
Wow.
This is the cerebellum.
The other
lower
day I
part.
had the 4s, 5s, and
That's
some
right.
6s.
That's right. This is the lungs. This is another take of the heart, part of the liver, and we can also see a big improvement here in the lungs. Okay, as well as the heart,
Yep.
and the liver is everything is okay.
All
Looks
right.
good.
Looks good.
Okay.
Okay.
This is a take at the level of the shoulders.
Okay.
The shoulders, and this is the thyroid gland. This is part of the spinal vertebra, muscles of the back. So far, okay.
Wow.
The more yellow spots you see, the
Yeah.
healthier you are. This is another cut of the at the level of the thorax. This is the sixth vertebra of the thorax. To see a better look at the lungs and at the heart. Right now, very healthy heart.
Nice. Nice.
Okay, you can see kidneys,
Yep.
large vessels of the abdomen, aorta, cava inferior, right kidney okay, left kidney okay. Very good,
Wow.
very good.
Huh.
Okay, this is abdominal cavity at the number 1 lumbar vertebra level.
Yeah.
Okay, you will see here mostly part of the intestines, pancreatic organs, some kidneys here, and
Yeah.
part of the liver. This is at the level of the fifth lumbar vertebra.
Yeah.
All this is large intestine. You can see here the lower part of the kidneys.
Mm-hmm.
Okay. Sexual organs.
Mm-hmm. Let's hope this shit's good.
The bladder, prostate gland,
Mm-hmm.
rectum. Okay.
Okay. Everything's looking pretty good.
This is a sagittal cut of the chest.
Mm-hmm.
You see here the heart, the aorta artery, part of the liver, and the spinal cord here, the
Mm-hmm.
vertebrae. Everything's very good, my friend.
All right. Well, there we go. Everything's looking good. I'm on the way to healing. Thank God.
Mhm.
Thank God.
This is the pelvic area, the pelvis. This is the hips, prostatic gland, rectum. Everything okay.
Now, what about? Is it kind of the system that would show something about my psoriasis
Yes.
skin?
Yes, we're gonna see the skin
Mhm.
cells. This is the skeleton.
That's
It's healthy. the stomach.
Yeah, I remember there was a problem over there.
You're okay now?
Wow,
It's healed.
it's healing.
This is the duodenum, which is the first, the first section of the small intestine.
Mm-hmm.
Very important. This is the pancreatic head, the pancreatic body. Looks healthy too. This is the pancreas model outside.
Mhm.
You know, look. If you open the abdomen, you will see the pancreas as it is like that, and you see here the bladder. Excuse me, the spleen. Right here is the spleen. Okay, and the circulation for both pancreas and the spleen are
Yep.
considered normal.
Good.
Large intestine as well as the small intestine. So far healthy. Very good, my friend.
Okay.
Are you doing?
Got a good update.
Your stools are getting better.
Yeah.
I remember the last day you told me that you were doing quite a soft stools.
Yeah.
But now are
Getting
better.
a little better. Yeah.
Okay, this is the liver. You remember that the liver was one of the most affected parts of your
Yeah.
body? Now you can look at it. Now right here we see a spot. I can pause this. We see a stress area right here.
Mhm.
A remaining stress area. That's a 4. In the
Okay.
category of health,
Yeah.
that's a 4. Now we're gonna see what's going on in there. We're gonna take a piece of that. We call it a virtual biopsy test.
Mhm.
We're gonna test it, and we're gonna run some comparison with some of the diagnostic features that the software has. Okay. Now we're gonna test it, and right here I have options, diagnostic options. Like for instance, looking for a diagnosis, it means you have chronic hepatitis persistence, which means that you have a small area of swelling of the liver. Okay, do not be misled. Okay, this is just an inflammatory reaction focalized in a very small area of the liver. It's not
Okay.
affecting
It's
the
not
liver.
hepatitis C.
No, not necessarily. We will see microorganisms that could be involved. Okay. Doesn't see vitamin C. That doesn't mention it.
Okay.
The virus doesn't mention it.
Okay.
So actually, it's not an infection. Okay. Could be a chemical reaction.
Okay.
We see the entropy analysis. Entropy analysis, I don't know if you remember that I mentioned
Right.
to you that entropy analysis is 7 levels of distortion of the physical body.
Right.
The higher entropy level, the more destruction, the more the distortion
Mhm.
of or imbalance of the physical body, of a physical structure. So right now you have been showing that you are that particular spot.
Mhm.
It is a number 6,
Okay.
which can lead us, if we don't treat it,
Mhm.
can lead us to easily to another stage. From
Right.
4 can easily go to a 5 stage of health
Right.
in that particular site. So we're gonna treat it. And how we're gonna treat it? We're gonna use methotherapy, reverse frequency therapy. That's what we're gonna use. And you will notice
With
how
these
this
headphones.
triangle is gonna change. You see a change?
Yep.
Dramatically. From a 4, it went all the way to a 2.
Wow.
Okay, so we correct that frequency, and the conclusion will be that those group of cells will stop, creating an abnormal signal, okay, an abnormal behavior.